I think the first thing I think about is my role as the director of the Family Therapy Clinic and being engaged with the community by providing mental health services to those that maybe wouldn't otherwise receive those services. They might not have access to health insurance or health insurance that includes benefits for mental health coverage. So the Family Therapy Clinic provides about 4,000 hours of services a year to this community. So that's the biggest way in which I think about I'm engaged at a community level. As a parent of a child with special needs who has Down syndrome, I get to support our graduate students who are working with other families that might be facing a really serious diagnosis or a chronic condition that they're going to have to navigate in their lifetime. And so to have lived that as a parent and a caregiver, but also to be able to kind of bridge that into my professional identity is really a win-win. Our master's students in training as marriage and family therapists are working to get experience working with clients with a variety of issues, and they do so within the community during the second year of their graduate training. So we have relationships with Hospice of Lubbock, Children's Advocacy Center, the Lubbock County Juvenile Justice Center, as a few examples of the placements where they're getting training as clinicians, but then the populations being served in those settings are also benefiting from the mental health care that we're providing. One of our newer partnerships is with the University Medical Center, and we have a clinic, the Children's Behavioral Health Clinic. And at that clinic, we provide services to children and families who've had a trauma experience, particularly medical in nature, where there's been a hospitalization due to an accident or injury or a major medical event. And we see them bedside for an initial assessment and assess them for acute symptoms of trauma. And then we refer them out for ongoing care if the needs, arise for that purpose. And then from there, we can see them on an outpatient basis for as long as they're needing to support the family or the caregivers involved for the care of that child, and also helping the child, regain a sense of confidence in managing through the illness or injury and finding their way beyond that trauma experience.